Heel pain is a very common complaint that we hear in our practice every day. If I see 10 new patients, usually 3 or 4 out of the 10 are suffering with heel pain. A lot of them tell me that their pain is very severe when they first get out of bed in the morning. They usually say the pain is 8, 9, or 10 out of 10 pain. They hobble around the bedroom for a little bit and the pain decreases to maybe a 4 or 5. As the day goes on, the pain escalates. They usually say if they sit at their desk and step up, it's killing them. If they get out of the car, the pain is severe. These are usual symptoms of something we call plantar fasciitis. The plantar fascia is a band of tissue that is in the foot. It supports the muscles of the arch, and it's very common for this area to be strained and inflamed. The most common symptom is this first steps out of bed pain. Most patients will suffer for a month or 2 and then finally call our office. However, we have many patients that have waited 6 months to a year or more before they come in, and then eventually the pain starts on the other foot. The pain usually will not go away on its own, and this is what patients are usually waiting to see if it will happen or not. The most common way to treat this problem is to control the motion that is causing this plantar fasciitis. When we walk, our feet start on the outside and roll in, and that is normal. That's called pronation. But people with this heel pain, they pronate excessively. They roll in much too much. So we need to make a pair of custom-made prescription orthotics that will precisely control this excessive motion. Along with doing that, we have them do physical therapy, we have them do stretching exercises, icing, topical treatment with biofreeze gel is very helpful. Sometimes they need oral medication, sometimes they need cortisone injections. Years ago, surgery was much more frequent with this. 95% of the time we can get rid of all their pain and they can return to normal activity, running, jogging, walking for exercise with no pain without surgery. There's a new treatment out which is called shockwave therapy, which is very successful.